everyone. Welcome to Digital Health Talks. This is Megan Antonelli, and today I am so excited to be joined by Andrea Thomaz. She is the CEO and co-founder of Diligent Robotics. They are transforming hospital operations through AI robotic assistance. You may be familiar with their robots. They're called Moxi. As one of the few female founders in robotics, Andrea has led her team to a remarkable milestone that we're going to talk about today that is changing how we think about clinical workflow automation. Hi, Andrea. How are you?
Hi, thanks for having me. This is so great.
I am so excited to have you. I mean, we had Erin Meary at HealthIMPACT in June, and I was literally at a conference this week where they were talking about the robots, talking about how she had nurses. Joyce Lito at Kaiser was talking about how she had nurses at one health system who want them at her health system. So I am just, it couldn't be more timely and it couldn't be more exciting to hear, your founder's story, and kind of how you got to here. So tell us a little bit about it.
Yeah, very exciting. I loved hearing that story. And just, we've come so far that we're at a meeting and heard about Moxy. I'd love to tell my story. So I did not come up in healthcare. I'm a roboticist and did my PhD at MIT in robotics some time ago, and was a professor in robotics and working on my passion has always been robots that work side by side with people. So human robot interaction was my research area. And I started the company with one of my PhD students, Vivian Chu, our CTO and co-founder. And we were really passionate about finding a market and a need where, robots could really join a team of people and augment that team with automation. So, we were pretty passionate about the fact that, we don't necessarily, a lot of places where you're going to find robots being really valuable, they're not necessarily going to take over a whole job, but they're going to add a lot of value to a team of people. And as soon as we started looking into healthcare, it was very apparent that this is exactly the problems that a lot of hospitals were having, that they had clinical teams that were not necessarily always doing patient care, not necessarily always doing their clinical work. Sometimes, they were fetching and gathering things. And so, we look at this and we're like, oh my gosh, we can build robots for this. This is a perfect application of, people plus robots. So we started the company in 2018 and did a lot of product discovery. We embedded ourselves with nursing teams across Texas. We're based in Austin, and asked people, what would you have this robot do, and why are you having to go from this place to that place? And but we were ready with a product in 2020, and we actually joined the Cedars-Sinai Accelerator Program in the end of 2020. And coming into 2021, we launched at Cedars-Sinai with our, they were our first robots as a service customer, and we've been scaling in market and really excited to see the product market fit. Really, we've seen a lot of different organizations of different shapes and sizes, like small rural hospitals to like large academic medical centers. Everybody has this problem of, people having to hand carry stuff in the hospital. So it's been really satisfying and exciting to see the product market fit that we're seeing. We're going to be we have close to 100 robots now. By the end of this year, it'll be over 100 robots live across 24 health systems and working 24/7, supporting those clinical teams. So it's been exciting.
Yeah, that's amazing. And it's such an amazing story, in that also the timing of it really must have been a bit kismet in terms of just the pandemic and where, the need and also the acceptance, right? So this whole, with the adoption and proliferation of AI and the interest of this, but then of course the resource challenges. But before we get into all of that, I'm just imagining you as a roboticist at MIT. We like to talk about female founder stories, and of course your co-founders with Vivian. Tell me a little bit about, what it was like. While your timing was perfect, I'm sure it wasn't all easy. So as a woman getting into this business saying, I've got a robot for you in healthcare, tell us a little bit about that, and about the challenges, whether it was,
Yeah.
As a woman or not, but, sort of what you faced, and some of the words of wisdom you might have come away.
Yeah, I mean, I think definitely as a woman roboticist, have always been a bit in the minority, um, but I also think there's something about that truly helped us in the early days, and like I said, we embedded ourselves with nursing teams who are 90% women. And so I could only imagine if we were a couple of dudes that were like, hey, let us come and hang out with you guys. I'm not sure that would have gone over as well. And so, I think we were really able to connect to the end users. And I also think that our approach is very user centric. Like, we are always asking, how can we build robots to more seamlessly fit into the human workflow, not the other way around. Like, I'm not just saying, here's this robot we built, why don't you figure out how to use it? So I think that's that empathy is.
I love that. Not to say that would be uniquely woman
Yeah, but
focused,
I
but
think there's a little bit more.
I hear it and I get it for sure. And I imagine, and that's a great point in terms of being a sort of woman founded business with a product that, I'm sure there was some skepticism when you were doing that research. Tell me a little bit about, you could have gone in anywhere. They need robots everywhere. What about healthcare made it like, this is the place?
Yeah. I was a professor at UT Austin at the time. We were thinking about starting the company. And, honestly, to leave that kind of a role, I wanted to go, and, Vivian also, we wanted to be doing something that was truly impactful. And there's a lot of different places where you could imagine a service team of people and robots joining the team. But when we started looking at hospitals and healthcare, you just saw the clinical teams and the frontline teams, and there was this. When you dug into, like, hey, why are you running around? Why are you going to do this? And it was like, well, because if I don't do it, my patient's not going to get their thing that they need. And like, I'm the last line of defense for this patient. And so that's like why I'm going out of my way to take this lab sample or to go get this medication. Because if I wait around for somebody else to bring it, then my patient's in pain. And so we just got so inspired by those, what better end users to be developing technology for than these passionate, caring people.
Right. Yeah. So many, opportunities for efficiency, but also impact, right? In terms of the value you can provide, even if it is, moving one thing to another place, but in a hospital that's as, big and has tons of moving parts and lots of things needed on different floors and different places, so totally, it makes absolute sense. And then again, of course, the timing, all of that. Tell me a little bit about, we know it has been in these health systems. What is the impact they're seeing? Where is the place that Moxy is providing that value for our folks that don't know about it?
Yeah.
Tell us a little bit about Moxy's a day in the life of Moxy.
Oh, yeah, absolutely. So we do, so Moxy does like point-to-point transport tasks is what we call it. But I think that we've been able to identify and help hospitals understand, when a lot, like you said, a lot of things have to be moving around hospitals to support patient care and all aspects of patient care, from lab samples to medications to supplies to equipment. And there's a lot of things that there's already a process in place for how that moves around. But then there's, all these things that kind of fall through the cracks. Like, there's these ad hoc, like, things that come up, and in a day in the life of a hospital, there's any number of ad hoc deliveries and transport tasks that have to be done by a person. For some reason, that has to happen. And so we help hospitals identify, hey, where are your staff having to run around? And let's make sure that your staff aren't running around, but a robot's running around instead. And today in the places where Moxie's working, that's primarily delivering medications between pharmacy departments and nursing units, or delivering lab samples between a nursing unit where the lab sample is being taken and it gets taken to the lab, or from the emergency department going to the lab, or central supply. There's a lot of things that central supply and materials management is like stocking onto nursing units. There's a supply room, but then there's a handful of things that you might need on a nursing unit that aren't stocked in your supply room. And so then somebody has to go and bring that from central supply up to you. So those are the kind of greatest hits, I would say, of the Moxi robot fleet. And then there's all kinds of creative ways that people think of, like, well, what about having Moxi bring this these things, documentation from radiology? Like, I could stick that in Moxi, can't I? And you're like, yeah, if you have something that needs to go from one place to another, we can make it happen. So
right. And you were saying it has a locked sort of box in it that uses the badge scan to kind of get through. So the things that are in it are secure and being brought, and they're being brought, often in elevators, right? And in terms of tell me a little bit. I know there's a recent milestone of 100,000, rides, and that tells us a lot about kind of the adoption. But I'd also tell me a little bit about kind of that infrastructure that, it's, how does it operate? Where does it live? And all of that. But I also want to hear about the milestone.
Yeah. So, a big part of what we had to do to really enable these transport tasks to happen hospital-wide is develop a general purpose capability of being able to navigate the hospital. And I think, when you first think about going and navigating the hospital, you think of that being primarily a mobile task. Like, oh, I could just have a robot with wheels and a container and be able to, get from point A to point B in the hospital. And it's mostly transport is mostly about moving on wheels. And what you find as soon as you start saying oh, I need to go from the pharmacy up to nursing unit on the 4th floor. Well, you're going to leave pharmacy and you're going to have to open a door. And then you're going to maybe have to open another door before you get to an elevator that you have to push some buttons to get on the elevator. You have to push some buttons to decide what floor you're going on. You have to get off the elevator and then probably open another door to get to the nursing unit on the 4th floor. So there's all of these manipulations that we have to do with the arm, that if we want the robot to interact with existing infrastructure. And that's kind of the biggest new thing that we brought to market, is this general purpose capability to interact with existing infrastructure. Because previously there are kind of products that are in the market for hospitals to do transport tasks for years. But in order to make those robots work, you have to install a control box in your elevator so the robots can talk directly to the elevator without pushing buttons. And same goes for any door that the robot might need to open. You'd have to install something so the robot can talk to that door via Bluetooth or Wi-Fi or something like that. So we are more generally available to hospitals that don't have that infrastructure, and they want robots to just be able to interact with their existing infrastructure. So, but it's very hard. This is like a hard mobile manipulation problem, like moving around in the environment and touching a button.
I'm a human being, and I have walked through a health system and been like, are you kidding me? Like, if I were sick, how could I ever navigate this place? You're going through some trans and you're going over the sky bridge, and then you've got to, and then, oh, this door needs a badge, but this doesn't need a badge. And I mean, it is, so that is, I haven't thought about that, but that's amazing in that you've built it to be able to navigate that fairly complicated maze of, hospitals are like, this building's built onto this building, then built onto this building, right? So,
oh yeah, there's definitely some Frankenstein hospitals out there. So that's, I think, what we think the significance for us of the 100,000 autonomous elevator rides is, and counting. Now it's more than that, but it's really that we've gone from something that is kind of research that you might be able to take a video of this robot doing this thing and post it on the internet to no, this is happening every single day, every single task. And it's really productized and it's ready for scale.
Right, ready for prime time. That's amazing. Well, in that and in getting to this point, there must have been some challenges. I'm sure. It wasn't easy. So tell us a little bit about, kind of both in the design, maybe a little bit more about kind of the design factors that were the big challenges. Then we can talk a little bit more about kind of working alongside. You talked, that this is about it's a companion tool to the humans and the clinicians working in the space. So tell us a little bit about those challenges too.
Yeah, I mean, so like my background is in human robot interaction, but the only like human robot interaction that I'd ever really studied was in the lab, right? We would invite people in to interact with our robots and have them do experiments. So it's been fascinating to have the actual like real world put a robot into an environment 24/7 and what do people do with it? And they dress it up for Christmas and they dress it up for Halloween and we just had something today. There's a robot at a hospital, and the remote team is like, this robot's neck keeps throwing errors. Like, what's going on? And this is very unusual. We just calibrated. It's like there's nothing that like says that this should be happening. Somebody sends us a picture of the robots, and somebody had like dressed them up and put tinsel around their necks. It's like, okay, so the robots can't move their necks because people are putting tinsel around. Like, so we had to call the hospital and be like, can you undress the Moxy robots and then they can get back to work? So I think those are the things that have been fascinating and that we've learned to see what people are going to do with robots in their environment. And it's led to some really interesting ways that we are kind of making the robot's behavior is kind of seamlessly fit in with people. So, one example, we've got the robot makes more responses to people than it used to because and when we first started deploying, the robot's a transport robot. It's on the job. It's not really talking to people. It's not doing things, but people were very excited to have this robot in their environment. And so we had to add ways that the robots, like even when they're like cruising down the hallway, if there's somebody that says hello, then we need to respond to that. And so so that was kind of fun to put some of those little extra things that just sort of get people excited about having a robot in their space.
Right. Well, and that's, as you talk about kind of the staff and the resources, and obviously coming out of the pandemic and where, the needs and the nursing shortages that were faced, so to have that helper was, sort of, they were more welcoming than they might have been 5 years ago, which is hard to believe it was 5 years ago. Yeah. Another thing that Joyce mentioned at the meeting the other day. But what I was struck by that Joyce had said was, that the nurses at one place liked it so much that she now needed to look at it, here. And I sort of live in this space where folks are so competitive around, well, if they're doing it here, it's the shiny object. We just have to do it, but to have staff tell you, I want this technology here. Like that's usually they're like, no, we don't want your technology. We're good.
Yeah.
So tell me a little bit about, I mean, obviously because you're coming at it from that human side of things, but what's that, what have you seen? And I imagine it was a journey. I mean, in terms of, the acceptance and adoption, what has come from that and what have you learned from that?
Yeah. It has been really interesting. Like I said, we went, our first deployments were in late 2020, early 2021. So that was a time when people were, really feeling workforce shortage, like acutely, really feeling burnout and stress from the pandemic, and really feeling like, oh my gosh, we have to do something to support our teams. And so, I think before that, like in 2018, 2019, when we were first starting the company and talking to people about robots to support their teams, it was, we were always getting we were always getting introduced to like an innovation team or a strategic team who's thinking about the hospital of the future. This is thought of as like, oh, this is something that's like many, many years away. Like, go talk to those people that are thinking about our hospital building that we're going to build in 5 years. And then, suddenly during the pandemic, it became top of mind for everyone. Like, oh, these things have to exist and we need these things to exist sooner because I need to support my clinical teams and I don't want people running around if they could be with patients. And so we pretty immediately got into thinking with real operational leaders who are truly like, I need to think about robotics and I need to think about automation. So that was the first shift that we saw like during the pandemic. And then the shift with AI has been fascinating because I think that's more been from the end users have now really said, oh, well, obviously robots exist because, chat GPT. Like, I think you've gotten this like expectation that like, well, of course, this is where we're at versus I think in 2021 and 2022, people were like, a robot is going to work with me? That's amazing. And they were very excited about it, but it was like, whoa, this is not what I was expecting. But
and
one
now
of the
they
things,
expect it
yeah.
to actually be able to summarize Catcher in the Rye.
Oh yeah. Yeah, exactly. So we've kind of like swung all the way in the other direction. So for us, we saw that kind of adoption like we saw one adoption flip at the kind of like organizational level and that like operational leaders saying, wow, I need to find something. And you guys seem like you're furthest along in this. And then at the end users, it's been a little more recent where people are like, well, why wouldn't I be working with a robot? And so, but then to your point about, the nurses really liking it or the pharmacists really liking it, that we found has everything to do with the workflow design and the change management in the hospital. So you look at what were they doing before, where are the pain points, and how can we truly make sure that we're adding automation in a way that's reducing those pain points. And 9 times out of 10, it's the nurses who are running around gathering things. And so those are the people who love Moxy the most because, one of the metrics that we even track for some of our hospital leaders because they love reporting it out to their staff is the number of steps saved. So we've saved 25,000 steps this week or this month. And so, it's concrete. It's like people really get like, yeah, I didn't have to run around.
Mm-hmm. I mean, and that translates so much into time and obviously burnout and stress and all of that. So that coupled with all of that, that's amazing. As you look and think about, kind of what's next for that, sort of the next in the evolution of human robot collaboration, right now it's transport. Are you guys, where are you looking to next in terms of what Moxy can do?
Yeah. So I think we're just scratching the surface of the kinds of I do think there's still a ton of just logistics support for hospitals that more and more sophisticated robots could help with. And so, we have a fleet of 100 robots. Those robots are collecting data about how they operate, getting more and more sophisticated in our AI models that are powering those robots. So I think we're going to start seeing is more dexterous manipulation. So today we are opening doors and taking elevators, but there's a lot of other things that we can be doing in the environment with more sophisticated manipulation skills. And I think we're excited to see that come down the line. And I think there's a lot of support to be provided.
So when you do talk to the occasional hospital who isn't saying, yes, get me one right now, what is your advice? What is the kind of reason that they should invest and invite Moxy into the hospital?
Yeah. So I think that most hospital leaders can look at their organization and say, I think everyone wants to do more with less because they can't find enough people. And so I think a lot of times we're helping hospital leaders say, like, where is it that your staff are wasting their time on things that a robot could be doing? And a big part of our process when we're starting to engage with a new client is workflow design. So we come in and we do a site assessment and we talk to a number of the stakeholders across the whole facility, and we start to understand, like, okay, where are the operational challenges? Like maybe pharmacy doesn't think there's any challenge with medication delivery because nurses are doing all the running, or it could be the opposite. Like nursing thinks, oh, medication delivery is fine, and it's because the pharmacy techs are doing all the running. And so you figure out where the pain points are, and then you kind of just redesign workflows around that. And it's a process. And we have now a lot of different examples from a lot of different organizations that have kind of successfully made that transition. And I think that's what's getting that's making it easier for like a health system who's skeptical. It's usually because they're like, I don't even understand how we would do this. And so what we've found is really helpful is kind of taking them through some of examples from our current customer base and say, well, here's what this facility did. And they had a challenge, similar to what you're talking about. And like, let us show you what before and after looked like.
Mm-hmm. Yeah, that's great. I mean, I think there's so much in terms of with technology where we have the tech and we bring it in. I mean, just like you said with the robots, here's the robot, let you see what you can do with it, and where you're going and really in saving, there's inefficient things happening in your hospital right now. This can help. Right. And, find the inefficiencies. We always talk, we like get rid of the stupid stuff, the program they started in Hawaii, around EHR stuff, but it resonates in healthcare. And it seems like, with this, where there's a lot of time wasted, that you're able to really come in and, there's infinite possibilities in terms of improvements. So that's great. As you look in our last few minutes, tell me a little bit, we like to always focus on the positive, what's coming, what's next. Tell us a little bit about, what you're most excited about, both in robotics and healthcare and AI and sort of human-centered design and the human companion, or, could be anything.
Yeah, absolutely. Well, I am excited about the speed with which we're seeing AI impact lots of different markets, but we're on the cusp of seeing that truly have kind of major changes in robotics and the capabilities that robots are able to have, and we're at the forefront of that, and I'm very excited to see that start to have real impacts in a real environment. So I would say next generation AI capabilities for robotics, especially robots that have arms, like that, I think is going to be a super exciting thing to watch and see and have a front row seat to.
Will Moxy always be the name? Will we go to Maxi? What's the next?
Well, I think that was what my next thing is. We are very excited to scale this like first product that we have doing ad hoc point to point deliveries, but we have a number of product adjacencies that have already been identified around larger load transport or more dexterous manipulation that's needed, and so I think we're looking forward to kind of expanding the product roadmap.
Yeah. So what's her voice? Is it a girl or a woman or a man, or is it just a robot?
So we try hard not to gender Moxy. It's whatever you want it to be.
Got it.
And but the voice lines do tend to sound a little more female. Yeah. It's hard to have a gender neutral voice line.
Right. Well, that's great. And it's so exciting, and I'm excited to see, everything that you guys do and see it roll out in more hospitals, and tell our folks on the line how to get in touch with you and if they want to learn more.
Yeah, absolutely. You can definitely find us on LinkedIn, so please connect and reach out. You can also go to our website. We can book a demo. We would love to show you Moxy and tell you more about it and how it could impact your healthcare organization.
Awesome. Well, thank you so much, Andrea. I could talk to you all day. I'm so fascinated by this technology and think there's just so much possibility. So thanks for joining me today.
Awesome. Thanks for having me.
Absolutely. And thank you everyone for joining us. This is such an exciting topic, and only the beginning of all of this. Andrea's work demonstrates that the future of clinical operations and is not just about technology, but empowering the healthcare workers to focus on what matters most. For more groundbreaking healthcare innovations, tune in to Health Impact and Digital Health Talks. Until next time, keep pushing boundaries in healthcare. This is Megan Antonelli signing off.